Hello, my dear students. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today, it's about MCQs based on uterus. So, the key of solving any MCQ is all of this, which I'm not going to read. You please pause the video and read it. These are a lot of rules and hints as to how one should solve MCQs and how there are some tricks by which there are higher chances of your getting an MCQ right. Okay, this is all researched. Kindly go through this. Meanwhile, what do we at VB Anatomy do to solve MCQs? This is how we do it. We solve the MCQ. Then we tell you why A, B, C, D are not the answers or why A is the answer. We will explain every option to you. There will also be portions where I'll be giving you notes, just a single short note to explain a little bit of anatomy around that MCQ. Next time, if you're in a hurry, just read the notes and solve your MCQs correctly. So the bottom line is solve MCQs as well as study any additional material on that topic so that if the MCQ comes around it also, you'll be able to solve it. Right, so let's jump into the game by asking ourselves a very simple MCQ. Organ containing thousands of oocytes. Stop, don't look at the options. This is very easy. Which organ contains thousands of oocytes? Obviously, the answer is ovary. Is that there in the option here? Uterus, ovary, cervix, fallopian tube? Yes. Ovary, B is the answer. Sometimes MCQs are luckily very easy. Okay. Next one. What is the name of the vesicle in the sperm which contains enzymes that help in penetration of the oocyte? Again, you don't have to see the options. Which is the vesicle in the sperm that helps it to penetrate into the oocyte? We know it's the acrosomal cap. So let's see if that is there in the options. Sertoli cell, acrosome, islet Langerhans, scrotum. Answer is B, acrosome. Correct. MCQ 3. The levels of this hormone are raised during parturition and help in contraction of myometrium. Is it progesterone, estrogen, oxytocin? Okay, stop. I think it is oxytocin. It is oxytocin that causes uterine muscular contractions. So, prolactin is involved in breast milk secretion. So, answer is C. Yes, it is oxytocin. Raised levels of following hormone in urine indicates pregnancy. What is that pregnancy test? The urine pregnancy test. It is based on HCG, human chorionic gonadotrophin. So, what are the options here? Estrogen, prolactin, human chorionic gonadotropin. Yes, that's the answer. So, raised levels of following hormone in urine indicates pregnancy. Human chorionic gonadotropin. The first menstruation in a female is called as menopause, B, menarche. Menopause is ending of menstruation. Menarche is beginning of menstruation. Dysmenorrhea is pain during menstruation. Menorrhagia is excessive bleeding. So, beginning of menstruation, the first menstruation has to be B, menarche. Yes, that's the answer. Starting of menstruation before the age of 10. Now, any menstruation that starts before the age of 10 has got to be abnormal, right? We normally know that women will hit menarche around 11, 12 years of age, a little later than that. So, premature menstruation may be B, delayed menarche. No, this is premature menarche. It's not delayed. So, B is not the option. C, early menopause. Again, no, we are talking about starting of menstruation, not ending of menstruation. And D, precocious menarche. So, according to me, it's either A or B. Precocious is often a word used for early. So, I think D is the answer. Yes, D is the answer. Precocious menarche. So, we are slowly getting into the subject. Let's go to the next MCQ. Which of the following statement is false? After menopause, the ratio of uterus to cervix becomes 3:1. This is a sentence I have not read, but let's see what the other options are. At menarche, the ratio of uterus to cervix is 1:1. This also I am not sure. At birth, the ratio of uterus to cervix is 1:2. That is true. If you recall, all books state that the uterus is small and the cervix is big, 1:2 at the time of birth. At the time of adulthood, the ratio is uterus 2 to cervix 1, 2:1. So both these C and D are correct. So if menarche lies between the two, B is possible. It is possible that at menarche the ratio of uterus to cervix could be 1:1. But after menopause, uterus cannot further increase in size normally to go to ratio of 3:1. Abnormally, of course, it can increase in size. So this is a statement I feel which is under normal circumstances false. So A is the option. Yes, A is the. So sometimes, see, you have to work at MCQ. You have to use what knowledge you already have and then try and work out the answer. Okay. So let's go to now option MCQ 8. A condition in which uterus turns backwards in relation to the long axis of vagina. Now here I want you to think. This is the vagina. This is the uterus. Okay. So in this case, what are they saying? The uterus has turned backwards in relation to the long axis of vagina, right? So this position is called anteversion. Therefore, this position must be called retroversion. So this uterus is retroversion of uterus, anteversion of uterus, prolapse of uterus, retroflexion of uterus. It's definitely not prolapse. Anteversion, they are saying it has gone from anterior to posterior position, it has turned backwards. So, but it is not retroflexion. When the uterus bends on itself between the cervix and the uterus, the angle is anteflexion. They are talking about angle between the vagina and the uterus. So the answer has to be a retroversion of uterus. Let's study a little bit more to understand this better. So here you are seeing the axis of cervix and the axis of vagina. The angle between them is anteversion, 90 degree. Here you are seeing the axis of uterus and the axis of cervix. The angle between them is anteflexion, 125 degree. So now one last time, vagina, cervix, 90 degree, anteversion. Cervix, uterus, 125 degree, anteflexion. This is the normal position of uterus. See, so this is the portion that comes under notes, and whenever you're studying, come back to the notes, quickly brush through and then solve your MCQs. You will find yourself solving them more confidently and more correctly. Right. The condition, therefore, we come back to the same MCQ. The condition in which uterus turns backwards in relation to long axis of vagina. Remember V for vagina, V for version. Okay. Retroversion, anteversion. Anteversion is uterus falling forwards. Retroversion is uterus falling backwards in relation to vagina. Therefore, now we know A has to be the answer. Yes, it is. Normal position of uterus in pelvic cavity is, now we've done this, it is anteverted, anteflexed. Anteverted between vagina and cervix, anteflexed between the uterus and the cervix. So, B is the answer. We don't need to study this again. Let's go to MCQ number 10. Regarding the position of uterus, following is false. Same, related to the same anatomy. Regarding position of uterus, following is false. Remember, we are looking for a false answer. We are looking at something which is wrong. False answer. Okay. So, the uterus is normally anteflexed, anteverted in position. It's true. Angle of anteversion is 125 degree. I don't think so. We just decided it is 90 degree. So, this is going to be the false sentence. But let's read the rest of the options. Uterus is held in position by round ligament of uterus. Yes. Uterus rests upon the superior surface of urinary bladder. Yes. So, A, C and D are correct statements. B is the false statement and is therefore the answer. Okay, and angle of anteversion is not 125 degree, it is 90 degree. Right, so B is the answer. Let's go to MCQ number 11. All the following are supports of uterus except. So let's begin to read. Ligaments of cervicovaginal junction, puborectalis, broad ligament, round ligament of ovary. Now, this is something you need to think. When was the last time you read about supports of uterus? So now, when was the last time you studied the supports of uterus? Must have been long time. Not all the anatomy is not fresh in your mind. So let's refresh your mind with the help of this single sheet. This single sheet is showing you all supports of uterus. There are muscular supports such as levator ani, urogenital diaphragm, perineal body. There are ligamentous supports, those cervicovaginal ligaments which are coming from the pelvis and attaching themselves to the region around the cervix and vagina. Then the support in the form of angulation, anteversion, anteflexion, brought about by round ligament of uterus. Peritoneal supports such as various peritoneal folds. This includes broad ligament. Visceral supports of surrounding viscera such as urinary bladder anteriorly, rectum posteriorly, and then the surrounding connective tissue in the form of parametrium. So this is a single sheet that gives you entire classification of supports of uterus in one sheet. With this knowledge, let's go back to our MCQ. If this sheet is not enough, please feel free to study supports of uterus in a separate video under VB Anatomy. Link is given in the description section. Again, what is round ligament of ovary? So here you are seeing the uterus, and here is the round ligament of ovary extending from the ovary here to the uterus, the lateral angle of uterus over here. Whereas this is your round ligament of uterus extending from the angle of uterus to the labia majora. So you can see that it is the round ligament of uterus that is pulling the uterus forwards into anteverted, anteflexed position. But the round ligament of ovary is actually just anchoring the ovary. It is not a support of uterus. So, question is, what are round ligaments? Why are we discussing them? So again, this is an immensely often asked question. The round ligaments in females are remnants of something called gubernaculum. Gubernaculum is a cord-like structure that extends from ovary down to the developing genitalia. What happens is, during development, this gubernaculum in the females gets attached to the uterus and gets divided into two parts. The part that attaches to the ovary, called ligament of ovary, part that attaches to the uterus, called the round ligament of uterus. It is this round ligament of uterus which is supporting the uterus, and the round ligament of ovary is maintaining the ovarian position. Think about this, read this again, expect a lot of MCQs on this very simple concept. So we come back to the same question. All the following are supports of uterus except ligaments at cervicovaginal junction, yes. Puborectalis, yes. Broad ligament, to some extent, yes. Round ligament of ovary, no. The round ligament of ovary is actually only an anchor to the ovary. It is not a support of uterus. Right. So let's move on to the rest of the video. So therefore, D is the answer. So one last bit before we move forward. Like the females have a round ligament, do males also have a round ligament? Yes, they do. So in the males also there is a round ligament that is also a remnant of gubernaculum. It extends from the testes down to the developing scrotum, and it is also a remnant of gubernaculum, remains behind in the form of ligament of scrotum. You will find much more about this if you go and study the video on inguinal canal. Okay, right. So the male and female round ligaments are different in that the male round ligament helps in the testicular descent and stabilization. The female round ligament is actually acting as a uterine support in its distal part. In its proximal part, it is only acting as an anchor for the ovary. Right. So we'll continue now. Following factors can cause prolapse of uterus except. What can cause the uterus to prolapse? Postmenopausal, possible. Loss of weight of uterus, I am not sure. Chronic cough, of course, if you have chronic cough, you will have increased intra-abdominal pressure, causing the uterus to come out in the form of a prolapse. Prolonged period of debilitating illness. What will happen in prolonged period of debilitating illness? Weakness of ligaments and muscles. If the ligaments are weak, they're not going to be able to support the uterus, causing it to prolapse. So this too is possible. So I think B should be the answer, considering that it is least likely. Correct. B is the answer. Sometimes MCQs are solved on basic common sense. Let's not forget that. That's a very big friend. Following are factors associated with uterine prolapse except. History of prolonged period of parturition. What is the meaning of this? It means that she's had a very long period of delivery. So if that is happening, then there's a lot of stress on her perineal muscles and ligaments. Likely is that she damages something and it can lead to uterine prolapse. Fibroid of uterus, yes. If this is the uterus and you have a fibroid at a higher level, it slowly begins to pull the uterus down, causing it to come out, causing uterine prolapse. So this is also right. Injury to lacunar ligament. Now many of you must be forgetting what is lacunar. So we'll go to that. I am not sure about this. And then let's go to tear in perineal body. Of course, tear in perineal body always leads to uterine prolapse. So possible answer is C, but let's still investigate. So here's your perineal body. You can see it over here. This perineal body seems to be receiving attachment of muscles from all directions, right? And if this perineal body is injured, all these muscles will lose their anchorage, causing a prolapse to occur. Whereas, here you're seeing the articulated pelvis. You're seeing the inguinal ligament here, going from anterior superior iliac spine to the pubic tubercle, turning inwards to form a triangular ligament called lacunar ligament. Now here you can see that this lacunar ligament has very little to do with supporting the uterus. So if this lacunar ligament is damaged, would you have a uterine prolapse? I doubt it. These are all the rest of the remnants of inguinal ligament or extensions of it. So, following factors are associated with uterine prolapse except. History of prolonged parturition, yes. Fibroid of uterus, yes. Tear of perineal body, yes. Injury to lacunar ligament, no. Therefore, we know our answer is C. This is called learned MCQ solving. There can, of course, be a random MCQ solving where we keep on tick marking C, hoping it is correct. But no, that's not the way we want to solve our questions. Let's go to MCQ 14. Following branches of internal iliac artery supply uterus and vagina except. Please read this question carefully. It has got a lot of points where you can go wrong. Following branches of internal iliac artery, they all have to be branches of internal iliac artery, will supply uterus and vagina. What are my options? Uterine artery, vaginal artery, ovarian artery, internal pudendal artery. How many of you remember internal iliac and its branches? So let's revise. Now this is your internal iliac artery here. That's the external iliac here. You can see internal iliac dividing into anterior division and posterior division. Anterior division is giving rise to superior vesicle, obturator, uterine artery, inferior vesical artery, which in females is called vaginal artery, middle rectal artery, and two terminal branches, internal pudendal and inferior gluteal. This, in short, is your anterior division of internal iliac artery. Did you see ovarian in this? No, you didn't. Note. Let's go to the further discussion of the same. Here you are seeing the uterine artery giving rise to an ascending branch which is supplying this side of uterus and a descending branch which is the vaginal branch supplying the vagina. Assisting here is the vaginal branch of internal iliac and branches of internal pudendal. All are supplying the uterus along with ovarian artery, a branch of abdominal aorta. Okay, this is knowledge. Now, using this knowledge, we solve our MCQ. Following branches of internal iliac artery supply uterus and vagina. Uterine artery, yes. Vaginal artery, yes. Internal pudendal artery, yes. Ovarian artery, yes, it does. But it is not a branch of internal iliac. It is a branch of abdominal aorta. The question was following branches of internal iliac. Therefore, ovarian artery is our answer. Answer is C. Moving on. All the following are branches of uterine artery except. So again, we are coming to the same concept. We saw uterine artery give rise to vaginal artery. We saw it giving rise to ascending artery. But what is helicine? What is radial? Let's understand. So here you are seeing the uterine artery dividing into anterior and posterior branches called coronary branches, arcuate branches or helicine branches. So these are helicine branches. Okay. They give rise to next lot which enters into uterus called radial branches. Radial branches then go on to form a stratum vasculaire within the musculature, which give rise to two types of branches, basal branches and spiral branches. Spiral branches are the ones that are torn, causing menstrual bleeding. This is concept. Go back to the MCQ now. All the following are branches of uterine artery except vaginal, yes. Ascending, yes. Helicine, yes. Radial, yes. Therefore, all has to be the answer. E has to be the answer. Yes, it is. Okay. So, MCQ 16. Following is an example of purely vaginal wall prolapse. Cervical prolapse, uterine prolapse, rectocele, vaginal vault prolapse. Now let's accept the fact that all of us do not remember prolapse and various terminologies in it in detail. So let's quickly run through some notes. Here you're seeing, this is the vagina here. Okay, the section has not gone through the uterus. Here you can see the fallopian tube. So here's the vagina. This is the anterior vaginal wall. And here is the urinary bladder. You can see that the anterior vaginal wall has become weak and the urinary bladder has prolapsed backwards, causing a bit of a kind of prolapse which is called as cystocele. A prolapse that involves a urinary bladder is called as a cystocele. Here, the urinary bladder prolapses backwards into the vagina. It's a vaginal prolapse. Here you are seeing now again, this is the anterior wall of vagina. Okay, you can see that the anterior wall has become weak in the lower part, and so the urethra has started to flop backwards, and this is called as a urethrocoele. This is called as a urethrocoele. So if the upper vaginal wall is weak, you get a cystocele. If the lower vaginal wall is weak, you get a urethrocoele. Both are purely vaginal prolapses. Okay, now let's talk about posterior wall of vagina. Here you are seeing the posterior wall of vagina which has become weak. So a bit of intestine has started to come downwards through that gap, through the pouch of Douglas. And what you're getting is called as an enterocele. Posterior vaginal wall is prolapsing inwards, carrying with it a bit of intestine. This is called as enterocele. Again a vaginal prolapse. Now here you are seeing lower vaginal wall is weak, so a bit of rectum has started to prolapse forwards. This is called as a rectocele. Upper part of posterior wall of vagina, enterocele. Lower part of posterior wall of vagina, rectocele. Okay, so all these are vaginal prolapses. Cystocele, urethrocoele, enterocele, rectocele. All are vaginal prolapses. Here you are seeing the uterus itself has started to come down. As it comes down, it's going to turn the vagina inside out. This is uterine prolapse. Okay, this is uterine prolapse. Now let's go back to the question. Following is an example of purely vaginal wall prolapse. Cervical prolapse will carry uterus. Uterine prolapse will carry uterus. Rectocele is a vaginal prolapse. Vaginal vault prolapse, the upper part, the entire vagina prolapsing down, will again carry with it the uterus. Therefore, C is the answer. Let's go to MCQ 17. Following are types of purely vaginal wall prolapse. Now revise in your mind. Okay? Cystocele, urethrocoele, rectocele and trocele. All are vaginal prolapses. So cystocele, vaginal prolapse, rectocele, vaginal prolapse, enterocele, vaginal prolapse. Uterine prolapse is a uterine prolapse. Therefore, A has to be the answer. So now we have completed 17 MCQs. We have discussed a little bit about prolapse, discussed quite a bit about the blood supply of uterus and vagina. In the next lot, which is Uterus MCQs Part 2, we will be going more into discussion and MCQs related to prolapse of uterus. Alright, so I'll see you in the next session. There will also be a third session which will involve a lot of congenital anomalies and questions related to the development of female reproductive system. I hope I'll see you there as well. If you have any doubts related to these MCQs, please contact me either by email or by WhatsApp to the following number. If you have doubts, you want to learn more about uterus, anatomy of uterus, please go to Anatomy of Uterus, a video on baby anatomy. If you've liked the video, do please like and subscribe to the channel. Please ask me some questions, pass some comments so that I'll know whether my work, which is considerable now, is really helping you or not. You can share with a friend as well. Thank you. I love taking this class with you in helping you in some way towards your endeavor in solving MCQs correctly. I'll see you across the screen in my next video on Uterus MCQs Part 2. Bye.